So good evening to all. So today's topic regarding the autocoids that leads from the pharmacology. That is the autocoids. Autocoids. Autocoids means the local hormones. Local hormones. Clear? What is autocoids? Autocoids means the local hormones that affect the several parts of the body. Clear? Means the overally the autocoids is the local hormones. Then we move to the classification of antihistamines. Their classification of antihistamines. Classification of antihistamines. The antihistamine has two types. First, the classification is two types. First is first generation. Third generation and the second generation. The antihistamines, first one is the first generation and the second generation. Clear? Then first generation is highly liquid soluble. Is highly liquid soluble. Clear? The first generation antihistamine is highly liquid soluble. Clear? Then it crosses BBB. Clear? It crosses BBB means the blood. It crosses the blood-brain barrier. It crosses the BBB means blood-brain barrier. The first generation antihistamines is a highly liquid soluble, and first generation antihistamine crosses blood-brain barrier. It is the one-liner question. The question asks which antihistamines is crosses the blood-brain barrier. That is the first generation antihistamine. Then the first generation antihistamine side effects are the sedation and drowsiness. First one is the sedation. Second one is the drowsiness. This is the side effect. Clear? The first generation antihistamine side effect is the sedation and drowsiness. Is the side effect of first generation antihistamines. So this differentiation is very much important, so write down this. So then the second generation antihistamine. Second generation antihistamine is less liquid soluble. Less liquid soluble. Less liquid soluble. Clear? The second generation antihistamine is the less liquid soluble. Clear? So the second generation antihistamine is the less sedation and drowsiness. Clear? So the second generation antihistamine has less sedation and drowsiness. So the second generation antihistamine have less sedation and less drowsiness. So this is very important and question comes from this. Then we move to the drug of first generation antihistamine. Clear? The first generation antihistamine drug. Clear? First generation antihistamine drugs. First one is the promethazine. Promethazine. Clear? The first generation antihistamine drug is the promethazine. Clear? That is the local anesthetic effect. Clear? The promethazine causes the local anesthetic effect. Then second one, the first generation antihistamine is the duxilamine. Duxilamine is administered in the morning sickness. The duxilamine is administered in the morning sickness. The duxilamine, the morning sickness. We also used in the duxilamine in the pregnancy. Why? Due to pregnancy, the morning sickness has occurred. So that we also use the duxilamine in case of pregnancy female. So duxilamine, if you administer some patient duxilamine, we also administer the vitamin B6. Duxilamine used with vitamin B6. Clear? We also administer the duxilamine in some patient, so that the simultaneously we also administer the vitamin B6. Why? The duxilamine causes the decrease of vitamin B6 in our body, so that we administer vitamin B6 in duxilamine. That is the one-liner question. Then third one is the chlorpheniramine. Daytime use. The chlorpheniramine, also first generation antihistamine, that used in only daytime. The chlorpheniramine is first generation antihistamine drug that also used in the daytime. Clear? So write down this. Then fourth one, is the cyproheptadine. Clear? That is the S2 blocker. Clear? The fourth one is the cyprohepatidin, that also the first generation antihistamine is the H2 blocker, cyprohepatidin H2 blocker. Then we move to the second generation antihistamines. Then the second generation, sorry, second generation antihistamine. The second generation antihistamine is the cetirizine. Here, the second generation antihistamine is the cetirizine. If the question asks what is the second generation antihistamine, you always mark the cetirizine. The second generation is the cetirizine. Yeah, cetirizine. Then what is the uses? Uses is common cold. Second one is the allergic rhinitis. Yeah. The uses of cetirizine, first one is the common cold, second one is the allergic rhinitis. Yeah. So the side effect of cetirizine is the most leading side effect is the GI upset. Yeah, GI upset. SE. SE means the side effect is the GI upset. GI upset. The side effect of cetirizine is the GI upset. It's GI upset. That is the most leading side effect of cetirizine is the GI upset. So that is all about the autocoids. So next class we will discuss about a new pharmacological topic. So thank you to all.